Dr. Liam Sullivan, one of the adult infectious disease physicians here at Spectrum Health.
Hi, I'm Rosemary Olivero. I'm a pediatric infectious disease physician at Helen DeVos Children's Hospital of Spectrum Health, and I'm a division chief here as well.
So thanks everybody for coming. I'm going to start with Dr. Sullivan, and just if you could kind of explain what's going on with Pfizer and the 12 to 15-year-olds and how this process works.
So as you guys have obviously heard in the news recently here, Pfizer has asked for an amendment to their emergency use authorization for their vaccine to get it approved by the FDA for children from 12 to 15 years old. And FDA is going to be, it sounds like they're going to be meeting about it next week to talk about it, and all signs point to them amending the EUA that Pfizer has submitted and approving use of the vaccination in the 12 to 15-year-olds. They recently did a trial in, I think it was a little over 2,000 participants. Half of them were placebo, half of them received vaccine, and the results of it were impressive to say the least. They did not have one case of COVID-19 infection in any of the vaccine recipients, and there were 18 cases in the placebo group, if I'm not mistaken. So it's very, very encouraging data, and I think it's pretty much a foregone conclusion that the FDA will authorize it. The good thing about this whole process is because they already have the authorization for adults, they don't have to go through this whole brand new process again. They just have to submit for an amendment. So this should be a little bit quicker than the normal EUA process.
Hey, Rosie, since you work with this population, can you talk a little bit about what you think this will mean to teenagers, and what sort of reaction you've gotten from that group thus far?
Yeah, I think that the reaction in the adolescent audience, so children 12 years of age and up who will now have access to the vaccine, I think the reaction continues to be very mixed. I think that for and what I've observed and heard from patients and families, as well as larger groups of people who are doing outreach and getting information directly from the community, it's still very polarizing. So for adolescents who have underlying health conditions, where they have been really restricting their activities out of literally a life or death type of perception when it comes to COVID-19, this is undoubtedly a huge sigh of relief to have such a safe, effective vaccine that can be available to children down to age 12. It is absolutely just astounding what that impact can be for that group of people. For those who don't have those underlying health conditions, or those who feel that their risk for contracting COVID-19 or getting severely ill from it, I think that this continues to be very challenging for people to understand whether or not they should get the vaccine, especially in the pediatric age group, where children have, for the most of the pandemic, have been spared from severe COVID-19. However, I think we do need to look at this much more carefully, because many of you have heard that just this week, we have seen that the numbers of COVID-19 infections in the pediatric audience have really just skyrocketed. So if we look back a year ago, children, and we're talking about all pediatric age groups, 18 and lower, they made up a very small percentage of the total COVID-19 infections, 3%. Now, as of this week, we're looking at children accounting for more than 22% of the COVID-19 infections in the United States right now. So the pediatric audience certainly can get COVID. They can spread COVID. Our older children, adolescents, and teenagers can do so just as efficiently as our older populations. And we have seen that pediatric hospitalizations in the state of Michigan have increased, with some children as young as infants up to older teenagers even getting critically ill from COVID-19. The numbers aren't huge, but we know that the potential for children to get sick is incredibly high. And then, of course, the feared life-threatening condition, MIS-C, continues to occur. Even with the new variants, we're still seeing cases of MIS-C that are happening in our pediatric audience. So, knowing that we can avoid death, disability, and hospitalization with such a safe, effective vaccine, I think we absolutely need to think about this more critically for our healthy population of adolescents and teenagers in the U.S. Some of the main reasons that teenagers themselves are nervous about getting vaccinated, or kind of swaying them away from getting vaccinated, we hear from the community that it really centers around these myths about the mRNA vaccines potentially impacting fertility. And I just want to say that those myths have been busted. They are not true, and unfortunately is really hurting our ability to combat the pandemic with the vaccine. Not only are we over a year into the COVID-19 pandemic, but we are about 5 months into giving the Pfizer and Moderna vaccines to literally millions of vaccine recipients. And there have been there's been no impact on fertility, either from natural COVID-19 infection or from the mRNA vaccine. So we really have no concerns that getting a vaccine as a teenager would have any impact on your fertility. And certainly being able to survive COVID-19 will affect your ability to have a family in the future. So certainly I think that this is really a no-brainer when it comes to our healthy population. And as you've heard me say several times before, so I'm sorry for repeating myself, but the pediatric population makes up an absolutely huge percent of the American population. And this is a population that's highly mobile, that's highly interactive. They do a lot of activities. They participate in school and extracurriculars. And this is a population that is really important when it comes to trying to get past the pandemic and avoid more novel variants from surfacing. So we in the pediatric world really need to take this opportunity to try to impact the shape of the pandemic in Michigan and the United States. This is absolutely the time. And I'm personally elated. I'm so happy that we have this access, but I think we really have a lot of work to do in terms of educating the public and getting dispelling some of those myths about negative side effects, and also that the fact that children just don't get COVID, because obviously that is not true.
Are there other myths that you want to talk about, or other things that you would say to this population to encourage them to get vaccinated?
Yeah, I think that one thing that we hear a lot, and this goes for any vaccine, including the seasonal influenza vaccine, but I think we've been hearing it even more with the COVID-19 vaccine, is that people feel disappointed or they feel hesitancy about getting the vaccine because it quote unquote makes you sick. And we do know that mild effects can occur after getting the first, and even more so after getting the second mRNA vaccine. And people feel a little bit confused about what that means. And really those side effects in terms of having pain at the injection site, having a short-lived fever, having muscle aches, feeling fatigued, just feeling a bit run down, this doesn't mean that you haven't contracted COVID. The vaccine didn't actually give you COVID. What the vaccine did was stimulate your immune system to make antibodies to protect you against COVID-19. So those are, when we have people who get those reactions, I like to reassure them that this is an expected side effect. You can take a little bit of reassurance in knowing that your immune system is doing specifically what we want it to do to respond to the vaccine. And if you don't have those side effects, great, you're lucky, that's wonderful. Most people, don't want to then take a vaccine that's going to affect their ability to go to school or go to work. But if you think about the ability of the vaccine to prevent COVID-19, that's going to cause a very prolonged illness and potentially hospitalization. And the long-term effects of COVID-19, we're just learning more and more about its effects in healthy adults, older adults with medical conditions, but then also our healthy pediatric population. Things in terms of needing to get clearance to return to sports, having long-term cardiac issues, having a long hauler syndrome with poor physical health, poor mental health. These are all things that are so important when we think about COVID. Isn't necessarily just the common cold for a lot of people who get it. And none of those things that I just described are going to happen in vaccine recipients. So I think we really need to think critically about those reasons why people don't want to get vaccinated and help to dispel those myths, because those short-lived side effects really are a drop in the bucket when we think about all of the good and all of the benefit that we can get from community vaccination strategies.
Feel free to jump in, anybody who has a question.
Hi, this is Julie Mack from MLive. Doctors, there have been news reports this week of a woman in West Michigan who died from COVID, although it's a little unclear that it was the same kind of blood clot that was related to the J&J. What are your thoughts about that particular case?
I don't know the specific details of that case. I did read the media reports like everybody else did. And apparently, if I'm not mistaken on the details, she received the Johnson & Johnson vaccine several weeks ago. So, and that there was concern that this may be related to that. CDC is doing an investigation of it, and until CDC comments on it, I don't think we're in any position to make any further comments on it. I think we just let CDC do their investigation and make a determination exactly what happened.
And I'll piggyback on that. I totally agree with what Dr. Sullivan just said. I think the other thing that we need to be cognizant of after the safety pause from the J&J vaccine is thinking about the risk of clotting disorders from COVID-19 itself. So the IDSA recently sponsored a podcast on this topic, and it actually did an infectious disease person led the conversation, but actually the speakers were hematology or blood doctors, and commenting on the risk of this very rare clotting risk after getting the J&J vaccine compared to what the risk is if you actually get a COVID-19 infection. So I think that we need to obviously take these safety reports very seriously, but we also need to zoom back out and think about what the risk is if you actually get COVID-19. Dr. Sullivan knows very, very well how common clotting issues are from acute respiratory COVID. So we need to think about that as well.
Absolutely. I mean, we see significant more blood clots in people who get active COVID infection in adults. And the risk of getting blood clots related to COVID-19 infection are far, far, far higher than they are getting it related to a vaccine. So I think that's very important. Like Dr. Olivero said, let's keep this in perspective here. These are extremely rare events. And when you look at it, the relative risk of comparatively speaking, it's not even close. With COVID-19, the risks of severe clots and other complications is much, much, much higher.
I like it with TV13. You touched on it a little bit about how this particular 12 to 15-year-old sect of our population is key in getting us past the pandemic. I wanted to kind of talk a little bit more about that when it comes to herd immunity, the concerns over the fact that we might not get there, and how much do you think if the kids were to be getting these vaccinations, if we would then get to herd immunity?
Yeah, that's a really interesting question, Val, and there's a lot of different ways to look at that. And I'm sure Dr. Sullivan has some comments on that as well. But when we think about herd immunity, you can think about it as a whole population. So you take all of our Americans all together, or you can think about it in subsets of ages or risk groups. So in some ways it's easy to think about herd immunity with the people that you're going to interact with the most. So that could be, just thinking about high schoolers or just thinking about middle schoolers. But I believe you're asking more thinking about the American population in general. Obviously if the pediatric population, just for simple math, makes up 25% of your population, and none of those pediatric patients get vaccinated, that is going to massively impede our US population's ability to achieve herd immunity, which will allow for less rampant spikes in coronavirus cases leading to hospitalization and whatnot. So I think as a general US population, it's critical for the pediatric audience to be involved in that dynamic. Also children, like I said, they're in public spaces frequently, they're cohorting together in schooling environments. So it's very, very important for children to be vaccinated, because that's a very large population of the United States population in general, then also the behaviors that they do just as normal childhood life.
I would agree completely with everything Dr. Olivero said. And I would also add, if you look at influenza, look at the influenza activity this year, it's non-existent. And part of the reason is it's non-existent. There's several theories of this, but one of the big drivers of influenza epidemics every year are kids. I mean, let's face it, they're in school together all day long, and they're doing all these activities that Dr. Olivero talks about. And then they go out into the community, they see their parents, grandparents, et cetera. And that's one of the biggest drivers of influenza epidemics every year. So it's absolutely essential that we get as many children vaccinated as possible to reach herd immunity. Whether we're going to reach herd immunity in the United States or not after this starts is obviously an open-ended question. I mean, if you read a lot of what the experts say about what level of immunity we need to reach to achieve quote unquote herd immunity, it's been a moving target throughout the whole COVID-19 pandemic. And it continues to be a moving target. And I think the epidemiologists, the good ones, will honestly tell you, they don't know exactly what level of combination of vaccinated people and people who have had natural infection, when you take the two of them together, what level it needs to be achieved to reach herd immunity in the United States. I think it's safe to say it's probably at least 70%, likely a little bit higher, particularly with these variants spreading throughout the country now, because they're much, much more contagious than the previous strains of coronavirus. But it remains a moving target, and I think it is still a concern that we may never truly get there because of vaccine hesitancy and other factors at play here. So we'll have to see. But this group of people is absolutely essential to at least moving towards achieving that goal.
I totally agree. And I'll piggyback on that one more little bit, and just food for thought for our teenagers who might end up listening, or our parents, or those who are involved in education. There's been a lot of creative thinking around how can the vaccine be used to help return to some normal activities in our teenage audiences. You know, it really breaks the heart of anybody who interacts with a teenager to know that, you know, your high school graduation can't occur, that your high school prom can't occur, that so many of these other events with finishing high school just not being a part of the life. And it really is very painful to know that we can't get through that. So I know that a lot of different school districts are thinking about, well, what would we have to achieve to be able to have those events again? And even let's think about our sporting teams being able to carry on contact sports without masks. You know, should there be some incentivizing of getting a certain proportion of the senior class vaccinated to be able to do those activities? And I think that's a really compelling way to think about it when we go to a smaller herd, right? And we know that these individuals are going to be interacting. You know, if you can get 75% of your senior class vaccinated, could you have prom? Could your sports team be able to operate like normal? Could we have a graduation ceremony? Those things I think are really important to think about, those things that we have a lot of longing for.
You know, and I'll just say one more final comment about herd immunity is that I think people need to keep look at the big picture with herd immunity too. If you look at smallpox, measles, and polio virus, we never, ever achieved herd immunity through natural infection with any one of those viruses. We needed vaccination to do it. And COVID-19 is going to be the same way. There's no way we're going to achieve herd immunity without a higher level of vaccination. If we only get 50% of the country vaccinated, whether they're adults or children, we're never going to get herd immunity. We're going to continue to have outbreaks of this disease for years to come. And so if people want to get through this and resume all those activities normally and not worry about all these outbreaks occurring, like Dr. Olivero was talking about, we need people to get vaccinated. And the only way we're going to do that is with a vaccine campaign, and we got to get the young people vaccinated, the adults vaccinated, et cetera. We are not going to do this through natural infection. It just isn't going to happen. And history has shown that it won't happen. And this virus is no different than the previous 3 viruses I talked about. We don't talk about smallpox anymore because it's been eliminated. True measles hasn't been eliminated. You know, we get a little outbreaks here and there of measles, but by and large, nobody worries about getting measles anymore. And nobody worries about getting polio. There's been a case of polio in the United States, I think, since the 60s or 70s. So, you know, it'd be nice to say the same thing about COVID-19, but we need vaccine to do that. We're not going to get there without vaccination.
Yeah, and I love those comments, Liam. I think they're super pertinent. And I think 2 points I'd like to make, and piggybacking off of that, is that our experts in the United States at the CDC, as well as many others, are fully confident that COVID-19 is here to stay. It is going to be part of our normal circulating respiratory viruses that have a seasonal pattern. It is here, and it is not going anywhere, unfortunately. So we really have to stop thinking about COVID-19 as a short-term event. It is a long-term event. And so we are going to continue to have to think about strategies, including vaccination, over the long term. So I wouldn't think about a 15-year-old getting vaccinated to get them through the next year. I would think about it as this is a lifelong phenomenon that we are going to have to deal with. We've also heard repeatedly that COVID-19 isn't the flu. Yes, we know that COVID-19 is not the flu, but you know what will make it a whole much more like the flu is vaccination. Because even if we can't eradicate influenza, which we have not done successfully and probably we never will, having a significant population vaccinated actually attenuates the ability of the virus to cause as severe disease in huge parts of our population. So I would love to think of COVID-19 like the flu, especially for our adult audience. And the way that we are going to get there is by vaccinating and causing milder disease across the board.
Looks like Andrew Feather has a question. Andrew?
Yeah, so you guys mentioned, those other diseases that we're seeing that vaccination has been used for in the past, and schools require children to be vaccinated against things like measles. Do you see that happening, and do you think it should happen that schools require children be vaccinated against COVID-19?
I think someday, yes. Right now, at the current state, just from a complete regulatory perspective, we cannot mandate a COVID-19 vaccination that's only been authorized by the FDA and has not yet been approved. We have to take those terms very seriously, and they have repercussions. So we cannot mandate an authorized vaccine under emergency use authorization. The mandate could occur if and when those vaccines get approved, which we hope will happen in the future because of all the wonderful safety and efficacy data that we have talked about today. So at this point, we cannot, and we will not be able to mandate the vaccine for anybody. Now, it doesn't mean that you can't motivate people. That's a little bit of a different scenario, but you cannot mandate it. 6 months down the road, we may be in a different place. And I think that at that point in time, if it's going to keep schools open, operational, and keep people safer and healthier, that may be a decision that that on the state level is taken into play. I'm anticipating that we will eventually be there where it will be a requirement. I can't say 100%, but there's obviously advantages to having that requirement, but we're not there right now.
Yeah, I would echo everything Rosie just said there as well. And I have a feeling at some point in time in the future, once these vaccines are fully approved by the FDA and they're not emergency use authorized anymore, you're probably going to see it mandated for a variety of things. How that shakes out remains to be seen, obviously, but school is probably one of them, and there's probably several other things we're going to see it shake out to as well, because you're already seeing reports of some colleges wanting people who are going to live in dormitories, for instance, be COVID-19 vaccinated, et cetera. So I think it's just sort of the beginning of all this. And I think as time goes on, we're going to see that more and more. But we need the vaccines to be fully licensed and approved by FDA before we're going to see really widespread requirements for vaccination to COVID-19. And I suspect, as Rosie said, that probably will come at some point in time in the future. When, we don't know yet, but that's probably down the road.
Chris Hall has a question.
Yeah, hi, this is Chris Hall at the Free Press. I had two questions. Is the study size adequate for the 12 to 15-year-olds? Because we're talking 2,200 kids, I believe. And what about parents who get the vaccine themselves, but refuse it for their kids? How do you plan to change the hearts and minds of people and those who are hesitant for the kids?
I think those are both excellent questions. So yes, you are right that the study numbers for the 12 to 15-year-old study that Pfizer conducted was much smaller than the adult trial that was done in the fall of last year. So it is a smaller number. However, in the randomized controlled trial literature, as well as other studies, we look at how the studies are powered. So they actually do a statistical analysis to see that if we have this minimum number of participants, can we actually get a reliable statistical read on the results? And the study was actually powered appropriately to achieve that end. Also keep in mind that study was really, again, looking at safety and efficacy, but we already had efficacy and safety data from 30,000 adults that were in the previous trial. So it does change the numbers a little bit and what needed to be recruited for those younger audiences. But because of the numbers that they were able to achieve in that study, there were sufficient numbers to then produce the safety and efficacy results that they published. So yes, it was big enough to reliably report what they did just this past month. And then the other question about parents being vaccinated and then saying not to do it for their children. I think that's a really unique situation that I think you can very easily leverage. So if the parents thought that the vaccine was safe enough for themselves and they received it, then I think that it naturally follows that they will believe that it's safe enough for their children to receive it. And I think especially if we can help to debunk the myth, the fertility myth, I think that's a major thing that has held parents up. They don't want to impact the future fertility of their children. So if they know that they themselves took the vaccine, they see all the positive benefits to that in terms of their normal life, as well as avoiding severe COVID. And then if they can be appropriately educated about the lack of fertility impact, then I think that it's just a nice next step to have your children vaccinated.
And I think another thing we got to talk to parents about, and Dr. Olivero would know a little bit more about this than me, but is talking to them about Miss C in kids. I mean, Miss C is nothing to be trifled with. It can be a very serious illness. And actually, truth be told, we're seeing a little bit in adults now, and they're very, very sick people. And it's a very real syndrome. And I think talking to parents about the potential risk for Miss C after COVID-19 infection in kids is another way to help motivate them to get their children vaccinated. Because I don't think any parent wants to see their kid in the hospital going through something like that. And sure, yes, most kids with Miss C survive. But now we're starting to find out that maybe there's some long-term effects from this syndrome that nobody wants to have to deal with. So I think avoiding COVID-19 infection altogether eliminates that risk. And I think that's another thing to talk to parents about and educate them about the benefits of getting their children vaccinated.
And the last question, Whitney, are you still there?
Yes, I'm still here. This is Whitney from Wood TV. You kind of just answered the question that I was going to ask, and it was for you guys to talk specifically about the risks associated with children catching COVID-19. I know, Dr. Olivero, you talked a little bit about the fact that these myths exist that children are, so low risk for getting COVID-19, and if they do, likely their immune systems are so grand and so great because they're young that they will be completely fine. But could you talk a little bit about the things that children specifically face when they get COVID-19?
Yeah, that's a great question. So, some children are very lucky. They have a very mild illness. Earlier in the pandemic, most children were probably mildly symptomatic to the point that they actually didn't get tested. So now our testing availability is so much better. So we're actually able to diagnose COVID-19 in more children. So it's been that way for several months now. But I think that, with the B117 variant, that's really the dominant COVID-19 strain in Michigan. It's so much more contagious. And we have a completely unvaccinated pediatric population. We've really seen the pediatric COVID infections really go through the roof. Like I said, going from 3% a year ago up to, over 22% at current day. And the hospitalization rate for Spectrum remains pretty low, below 2%, which is excellent. However, the patients who are being admitted to the hospital with acute respiratory COVID-19 are much sicker than they had been observed at any other time in the pandemic. So we are seeing that children can be even critically ill with acute respiratory COVID-19. And then, as Dr. Sullivan mentioned, Miss C, the post-infectious syndrome, it can often require intensive care as well. So these are really important things to keep in mind. Luckily, these are not common things for children, but certainly still can happen to otherwise healthy, normal people. So we do need to keep that in mind as we continue to work through the COVID-19 pandemic, which we've said, unfortunately is not going anywhere anytime soon.
Okay. I think we're all set then. I don't see any more questions, and I know Rosie.
Beth, I just have one quick one. Do we think that pediatric offices will begin administering the Pfizer vaccine to kids in order to make it easier for parents and more accessible?
I can't give you a timeline on that, but that is the intent. And I think that will really help having the medical home be supplied with the vaccine. The county health departments are a really great resource for parents and teenagers to go to find vaccine access. And our county health departments have actually been working with a large network of retail pharmacies to make it very accessible for families and teens. So I would call your pediatrician's office, but also visit your county website, and you'll get some very nice up-to-date information. And we have good access to vaccines for down to age 12. So we're really excited to roll this out in those age groups.
Okay, thanks everybody. Thanks for the questions, and thanks to Drs. Olivero and Sullivan for their answers. Appreciate it.
No problem. Take care.
Bye.